There's a word almost everyone uses wrong, and using it wrong might be the reason your headaches never get the right treatment. I'm Dr. Michael, and that word is migraine. People throw it around constantly. I have a migraine usually just means I have a really bad headache. But medically, that's not what the word means at all. And that mix-up isn't just a language slip. It can actually shape how someone treats their pain, sometimes for years, without ever getting real relief. Stay with me, because I'm going to walk you through exactly what separates these two things. Not textbook definitions, real, practical differences you can actually recognize in yourself or in someone you love. And near the end, I'll share a detail about two specific types of severe headaches that even confuses many people who've lived with head pain their entire lives. Let's start simple. A headache is pain or pressure somewhere in your head. That's the whole definition. It's a symptom, not a disease on its own. Almost everyone gets one occasionally, and for most people, it fades on its own without much thought. Migraine is something else entirely. It's a distinct neurological condition. A headache is only one piece of it, not the full picture. And here's the simplest way to hold on to this difference. Every migraine involves head pain, but not every headache is a migraine. Now here's where it gets useful, because the real difference isn't just in the label, it's in the pattern. Ordinary headaches tend to stay in their lane. Tension headaches bring a dull, pressing feeling, often across the forehead or the back of the head and neck. Sinus headaches bring pressure and congestion around the cheeks and forehead. These are usually contained, uncomfortable, but limited to just pain. Migraine behaves differently. It doesn't stay in its lane. Alongside the pain, people often deal with sensitivity to light, sensitivity to sound, nausea, sometimes vomiting. In some cases, something stranger shows up before the pain even begins. We'll come back to that. Here's a detail that catches almost everyone off guard. A migraine can last anywhere from 4 hours up to 72 hours. That's 3 full days. And for this condition, that's actually a normal, expected pattern, not automatically a red flag. Most people assume a headache lasting an entire day means something is seriously wrong. But for migraine specifically, that duration can simply be part of how the condition behaves. Now, let's clear up a location myth, because this one trips people up constantly. Many assume migraine always happens on one side of the head. Not true. Migraine pain location actually varies quite a bit. It can show up on one side, behind the eye, across the front, the back, or the entire head at once. Location by itself can't reliably tell you what type of headache you're experiencing. So, if location isn't the key, what actually is? This brings us to a comparison that genuinely surprises people, because two severe headache conditions get mixed up constantly, even though they behave almost like opposites: migraine and cluster headaches. Here's the paradox worth remembering. During a migraine, the body wants stillness, quiet, darkness. Lying down in a dim room usually brings relief because movement and light make everything worse. Cluster headaches flip that completely. People experiencing them often become restless, agitated, they pace. They can't sit still because the pain is so sharp and localized that stillness offers no comfort at all. Picture that contrast. One condition pulls a person toward complete stillness. The other pushes them toward constant motion. Two very different reactions from two conditions people confuse with each other all the time. There's more separating them too. Cluster headaches are typically shorter, lasting around 30 to 90 minutes, but they can strike up to 8 times within a single day. Migraines run the opposite way, longer episodes but far less frequent. Cluster headaches often bring eye redness, tearing, or congestion on the affected side. Migraines lean more toward nausea and vomiting. And to be fully honest with you, there's some overlap between the two, which is exactly why even trained doctors sometimes need careful evaluation to tell them apart. Now, let's talk about the strangest part of this entire topic. Aura. Aura refers to nervous system symptoms that can appear before or during a migraine's headache phase. Most people assume it's only about vision, like flashing lights or blind spots. Visual disturbance is common, yes, but aura can involve other senses too, not just sight. These symptoms typically last less than an hour. It's almost like an early warning signal from the nervous system, arriving just before the main event. If someone has ever described seeing shimmering lines or a strange blind spot right before a headache started, that's very likely aura. and that detail is worth mentioning specifically to a doctor, because it helps clarify exactly what's happening. Let's talk about what actually helps, because understanding all of this isn't just interesting information, it changes how treatment should work. Migraine treatment generally falls into two categories: short-term medicine, used the moment an episode starts, and longer-term medicine, aimed at preventing episodes before they happen at all. There's a smaller detail worth mentioning, honestly. Small amounts of caffeine may offer some relief in the earliest stages of a migraine, but this isn't a solution, and leaning on caffeine or pain medication too often can actually create a separate problem, sometimes called medication overuse headache, where the treatment itself starts triggering more headaches over time. This is exactly why guessing at treatment, without understanding what's actually happening, can sometimes make things worse instead of better. So, let's bring this together into something real and usable. If a headache comes with nausea, sensitivity to light or sound, and lasts for hours or even days, that pattern points toward migraine. If strange visual or sensory sensations show up right before the pain begins, that's likely aura, worth describing precisely to a doctor. And if the pain is sharp, one-sided, comes in short, frequent bursts, and makes someone want to move rather than lie still, that pattern looks more like a cluster headache, requiring its own specific approach. None of this replaces a real diagnosis. These conditions overlap enough that professional evaluation genuinely matters. But recognizing these patterns means you can describe what's happening with far more precision, which makes getting proper care faster and easier. One more thing, because safety always comes first. A sudden, severe headache, especially one described as the worst ever experienced, paired with confusion, vision loss, or weakness, is not something to casually assume is just a migraine. That combination needs urgent medical attention right away. Here's something worth sitting with as we close. So many people have lived with head pain for years, treating every headache exactly the same way, never realizing they might be dealing with entirely different conditions that need entirely different responses. That single assumption that all head pain is basically the same might be exactly why relief has felt so unpredictable for so long. I'm not going to end this by asking you to subscribe or click anything. I just want to leave you with one thought. The next time a headache shows up, instead of reaching for the same remedy out of habit, what would change if you actually paid attention to the pattern, the timing, and everything that comes with the pain, instead of treating every headache like it's exactly the same thing?